Hollow eyes. These can be extremely challenging to treat, and I've treated thousands of patients over the past decade, and I can tell you I've had issues with this too. The eye area is a problem. It just shows signs of aging quicker, partly because of the hyper movement we have around the eye. There's some bone loss that starts to happen. There's just a plethora of things going on. There are a variety of things to treat it, and I'm gonna list out from least to most invasive your best treatments for hollowed eyes. Let's get into it. And if you're new here, I'm Jordan Harper, board certified nurse practitioner, founder and CEO of a results-driven skincare line called Barefaced, where we focus around the concept of less but better. This is how I approach office treatments as well, because you just don't want to be overdoing it. You just want these tiny little tweakments, so that way you can just age gracefully, age well, and you can look and feel your best. If you like skincare, aesthetic treatments, and the occasional live chat, don't forget to hit subscribe. I launch a new video every week. We are tackling hollowed eyes, and this is an area that so many people struggle with. So whether you've already had treatments done or you're noticing this and you're wanting to know what treatment you should get, we're gonna break everything down so you are a more educated patient when it comes to considering office treatments for around the eye area. Starting from the top, the least invasive but a must in your routine. Did you think it was gonna be anything else but skincare? Because it's not. It is skincare. I think about skincare, the whole face. Obviously, this is like your insurance. Same as brushing your teeth morning and night. You need to be doing your skincare morning and night. Well, for the eye area, skincare is a little bit less corrective, but it's more preventative. It is very important, but you need to have a realistic expectation of what skincare can do for around the eye area. Because the skin around the eye area is thinner, it does start to show signs of aging first. Using skincare to boost collagen, like retinoids, and antioxidants to slow down premature skin aging, obviously sunscreen, hydrating ingredients to boost hydration to that area. All of those are essential to keep the eye area looking healthy and keeping the skin as healthy as possible, because you want to be thickening that skin area. That's why I love retinoids around the eyes. There's a handful of skincare products that I believe are essential to use for prevention, but I do think it's just important to have a realistic expectation of what skincare can do around the eye. And it's much more effective as a preventative mechanism than a corrective mechanism, but it's still a must, okay? Here are the 3 key ingredients I would make sure you were able to use around the eye consistently. Number 1, sunscreen. Was there any doubt? Sunscreen is essential. Number 2, vitamin C. This not only provides antioxidant protection, it also boosts the efficacy of your sunscreen. So the way I like to do it is vitamin C, full face around the eye area, and then sunscreen on top, because it's gonna boost the efficacy of your sunscreen. And it's also going to help brighten the under eye area. So it does a handful of things. And then lastly, for vitamin C, is essential for collagen production. And if you are over the age of 20, your collagen production is gradually declining. This is nothing to be scared about. It's just something to know. If you are over the age of 20, make sure you're using an antioxidant around the eyes, because you want your skin to have all the resources it needs to produce more collagen. I use vitamin C morning and night. Think of it as a tool during the day for protection and prevention, and at night as a tool for repair and correction to help boost collagen and keep those vitamin C reservoirs full, so when your body's ready to produce collagen, I have a full cup of vitamin C to drink from, and I can produce as much collagen as I want at night. Number 3, retinoids. This is going to help boost your cellular turnover and encourage collagen production. So they really work hand in hand, and you need collagen production to have healthy skin. You need cellular turnover to have healthy skin. This is why you look at a baby's skin and they're just so soft and youthful. Their cellular turnover is a week and a half, whereas ours, as we get older, it's like 6+ weeks and counting as we age. And again, this is nothing to be scared about, but if you just know it, you can address it. So retinoids are essential for boosting collagen, cellular turnover, and because the skin around the eyes does get thinner, this can help thicken the skin, which can make things like dark circles less visible, make fine lines and wrinkles less visible. So it's essential to use daily. And the thing about retinoids around the eye area is that they can be really hard to tolerate, which is why I personally love a retinaldehyde around the eye area. And the way I use retinoids around the eye, always an eye cream first as a buffer. You never want to risk getting the retinoids into the eye area, and then applying the retinoid on top. And again, you want to make sure this is one that your eyes can tolerate. So if you have sensitivity to retinoids, we have one at Barefaced called Retinol Skin Therapy. We has retinaldehyde in it, which is very well tolerated. It's an estimated 20 times more effective than all retinols with less sensitivity and irritation, which is why I love it around the eye area, because again, this can be a really challenging area to consistently use retinoids because they can feel so dry at first. Once you have those 3 key products in your routine and around the eye area, these are a handful of other ingredients that can be really beneficial at brightening, targeting redness, improving fine lines and wrinkles. The list goes on. I would consider this, but always start with the key 3 3 around the eye area and then build your routine from there. As far as an expectation of what you can expect from skincare around the eye area, it's gonna take weeks to months to notice changes around the eye area, and that's okay and that's expected. And that is because this area is just like tissue paper and it is just so prone to premature skin aging. And it's something that you want to be using consistently. Think about it like working out. Give yourself at least 6 to 8 weeks to start seeing some changes, and they're going to be subtle. Let's just be honest. And so take pictures of your eye area along the way, before you start, and maybe 6 weeks in, 12 weeks in, to see what kind of changes that you notice and appreciate in the skin. Honestly, even if you don't notice changes, if you're using those 3 ingredients around the eye area, that is doing something really great around your eye area, and your skin in general, to keep the skin healthy. Even if you don't notice some dramatic difference, it's still doing such impactful things for the skin. To me, those 3 things especially are non-negotiable. If you're not able to tolerate a retinoid, or if you're pregnant, you can consider a retinoid alternative. We have one called Overachiever, and it has bakuchiol, which has been studied used twice daily closely to be as effective as a retinol used once daily. So that's always an option if you're in a season where you're not able to use a retinoid. Something that I like to use with my skincare are medical grade silicone eye patches. These are reusable, they're incredibly thin, and I layer these. I do my entire skincare routine except for my SPF. I apply these on top, I let them sit for 15 minutes and take them off. What's happening when you're using that is it's acting as an occlusive barrier. It's allowing your skincare to work harder for you because it's driving that into the skin, and it also helps soften the fine lines around the eye. And if you're a side or stomach sleeper, highly recommend, because you're gonna wake up with sleep lines, and if you can kind of smooth those in before they etch in over time, it can be great at preventing sleep lines if you struggle to sleep on your back. So I love those, and I think of them as like a mini eye treatment. You layer your favorite eye products and then you apply the eye patches on top, and you're just gonna get more out of your skincare under your eyes by doing that. And you just need to leave them on for about 15 minutes. That's what you can do at home to keep the skin around the eyes healthy. And you have to have healthy skin before you even consider doing these office treatments. So now let's get into office treatments. First treatment I would consider if you are 35 or under would be microneedling. This is one of the least invasive office treatments that you can get. And if you're really afraid of getting office treatment, even if you're over 35, sure, try microneedling. It's minimally invasive. Think about aerating a lawn. It's going in, stamping those tiny needles into the tissue, and then encouraging new skin and new collagen to grow those areas where your skin has been aerated. It's very effective at collagen production, and typically it takes a series of 3 treatments. This is a great way to improve skin quality. It's not going to add a lot of volume if you're truly hollowed out, but it is a really great way to improve the skin quality, because having healthy skin is the foundation. You can also pair microneedling with treatments like PRP, and this is where they draw your blood, spin it, and they get the platelet-rich plasma, and they apply it after the microneedling has been done. PRP, and drives the PRP into those areas to those little tiny micro holes into the tissue. That's a way that you can use PRP topically along with microneedling. And then you can also use PRP outside of that as injections. There's also another way you can use PRP, and this would be treatment option 3, because this is more of an injection. It's a natural injection. It's using your body's own resources, so the likelihood of a reaction is very, very low. It's probably not 0, but it's very, very low, because you're getting the blood from your body, spinning it, and then just injecting it back in. There's PRP, platelet-rich plasma, and PRFM, platelet-rich fibrin matrix. PRP is more liquidy, and that's why it's typically used with microneedling as a topical. You can inject it, sure, it's okay. PRFM, platelet-rich fibrin matrix, is a little bit more effective because it's more of a jelly-like texture. So when you're injecting it into the under eye area, it's sitting there longer. Whereas PRP is just more liquidy. So it's like you inject it and it's like disperses. PRFM, you're gonna inject it, it's gonna sit there. So it's gonna cause the body to respond more. And if you can get the body to have a bigger response, it's likely that you're gonna have a better result, because you're wanting to recruit your body's natural responses to produce collagen and improve that area. If you're wanting the least invasive kind of like option for hollowing as an injectable, PRFM is going to be your best bet. People also swear by that for dark circles. If you've got severe hollowing, it might not do a lot, but it can improve the skin quality enough that you are satisfied with the difference. Results from that, you typically are going to do, just like with microneedling, you're going to do a series typically of 3 treatments, and maybe over the next 8 to 12 weeks after that, you start to see a gradual result. Typically a maintenance treatment once every 1 to 2 years. I mentioned earlier that if you're 35 or younger, consider microneedling. Now, I didn't say say if you're 35 or older, what you should consider. If you are 35 and older, I would jump straight to a laser resurfacing. And you need to go to a practice that is comfortable doing this around the eye area. Sometimes you have to actually put like a corneal shield in the eye area. This is something that if you're getting laser resurfacing, the concept is the same as microneedling. It's poking micro holes into the tissue, just like aerating a lawn, but you're using heat and energy and wavelengths. It's a little bit more invasive, which I personally like, and you're gonna get a little bit more of a dramatic result. There's also a little bit more downtime associated with it. With that, a more dramatic result is typically gonna be a more pronounced and extended downtime to get a more dramatic result. That's why I say if you're 35 or older, just jump to a laser, because sure, there's a little bit more downtime. I don't really care about that. And when I say downtime, 5 days where you're a little bit swollen and red, it's really like not that big of a deal. So it is important to know that there is like downtime, but it's not like anything where you can't be out and about. You're not homebound. I love laser skin resurfacing for the full face. It's something I try to get at least once a year, and I'm 37 now, and I will continue to do that because you just can't, with skincare alone, have that much of a collagen surge without doing a more invasive treatment. Love that, and it does such a great job of improving skin quality. And again, skin is the foundation. You will find that is my mantra. The fifth treatment that I would do before considering getting tear trough filler is radiofrequency skin tightening. There's a lot of different ways to do this. A lot of times, if you are noticing hollowing around the eyes, some of that could be just from skin laxity and just the volume shifts that happen with aging, totally fine. But you can use a radiofrequency device to help tighten and firm the skin a bit. Again, this is a non-invasive, non-surgical procedure, so the results are not going to be as dramatic as a surgery, but it's a great option to try if your provider thinks you're a good candidate before getting tear trough filler. The radiofrequency uses heat to stimulate collagen deep into the skin, so the results are gradual, but over time you should notice more fullness in that area, firmness in that area, and typically I would say it's anywhere from 3 to 6 treatments, and then you're getting a maintenance treatment or series treatments once every 1 to 2 years as well. This is when I would recommend tear trough filler. I mentioned that I would do these 5 things before tear trough filler, and that's just because a lot of times the problems that you see with tear trough filler, where you're seeing it visible at the surface, like you can probably see my eye, you can kind of see it right here. If your skin quality is not great, you're going to be more likely to see the tear trough filler pull at the surface of the skin. Also, hyaluronic acid fillers are water loving, so they're going to pull more water into the areas where they're injected, and so they can quickly, if you're not careful, especially around the eye area, just start to make the area look too full, and that's why I don't typically like them. There's just too much that can go wrong, and I would say maybe every 1 out of 10 people are actually a true candidate for tear trough filler. And if you go to someone who that's the very first thing they recommend for you, I would just be a little bit wary, because there are a handful of things that I think are beneficial to do. Like I mentioned, those 5 other treatments to do prior to tear trough filler. If you do end up getting tear trough filler, and if you are a good candidate, always make sure your provider uses a hyaluronic acid based filler. This way you can dissolve it if needed. I've had mine for over 8 years, and I will dissolve it because it's starting to be more visible when I smile, which is just, not ideal. The results of tear trough filler are pretty immediate. Obviously, you're gonna have a little bit of swelling, so I would say the swelling can last anywhere from 2 to 4 weeks, and then after that, you're gonna see the result that's gonna be longer lasting. Like I mentioned, my tear trough filler is from 8 years ago, so you do not have to get yearly maintenance unless visibly you're still noticing a deficit, and that's something I would just defer to your provider to say, okay, yeah, this is a good time to treat. But I would just be really, really careful in the tear trough area. It just lasts much longer than you would ever think. The last 2 options are more permanent options, more invasive options. So like I said, I'm going from least invasive to most invasive. Number 7 is fat grafting. This is where a plastic surgeon would go in, remove some fat from just various areas in the body. A lot of times it's around the abdomen area, inner thighs. Use that fat to inject in areas of hollowing. If done well, this can give a very, very natural result. The only thing about fat is that you don't know how much is going to last. And when I worked with plastic surgeons, they would always say about 70% of the fat would stay in the tissues, but the other 30% the body is going to kind of like reabsorb. So with the fat, it's a little bit less predictable how much is going to stay, but if done well, it can be a really beautiful result. The longevity of these results can typically be, it could last you for years. Obviously the face is still aging, so there's that factor as well, but like it's a much more long-lasting result. Last but not least, we have our lower blepharoplasty with fat repositioning. Okay, this is the most invasive treatment, but like let's not not be afraid of the most invasive treatments. A lot of times we invest so much time and money in non-invasive treatments, and then we end up getting the invasive treatment. And I still believe the foundation is healthy skin. So you always start with healthy skin. It is nothing to be scared of to get lower bleph with fat repositioning, and I am telling you, it can look amazing. Obviously, you want to go to a facial plastic surgeon that does this all the time. And they either, if you have a lot of skin laxity, they'll just excise some tissue. So it'll be like a little stitch typically along the lash line. And so they're removing any excess. Like, typical way that they do this is they pull down on the lash line. See it's called a snapback. If it's longer than like 2 seconds, that means like the laxity, because we lose elasticity over time, that is typically a sign where you might want to remove some excess tissue there. That's a laxity issue. And so there's a series of tests that they'll do to see what you're a candidate for, but they'll either remove some tissue here and you'll have a stitch along the lash line, and here with no incisions on the outside, reposition the fat pad to firm up the area. Typically, what you also want to do when you are getting that procedure is some laser resurfacing. So that way you're improving skin quality and firming and tightening the skin underneath. It is so pretty. It is such a pretty result, and it can look so natural. If you are just throughout an age, this is like just a general age, everyone's different, but like everyone wants to know an age. If you are 45 plus, it may be worth jumping straight into this treatment. So you've got your skincare routine, and then you jump, depending on the recommendation, obviously everyone's different, don't take this as medical advice, but it may be worth considering jumping straight into lower bleph with fat repositioning and a CO2 laser. So you're kind of like doing a handful of treatments at once. It can just look really nice. I worked with plastic surgeons for years. I think if done well, I am telling you, it is such a natural result. I shared these from least invasive to most invasive just because typically people like to start with the least invasive option. Totally get it. But it is something to be educated on, that you shouldn't be scared of a more invasive option. It can actually be cost effective over time, longer lasting, and give you the result that you actually want. Going to someone who is kind of familiar with all of these options, you have all the tools in your toolbox. So whether you're doing them or a plastic surgeon or an esthetician, depending on the treatment, you just have like entire arsenal, so you can offer the patient a more complete experience. Or just going to a provider that's going to recommend and know their limitations as well, and make sure that they are not just giving you an option of a procedure that only they can do, when really you're a better candidate for potentially a lower bleph. So those are the 8 treatments from least to most invasive. And if you have any questions on any of those, don't hesitate to drop them below. And if you want to hear more about skincare, office treatments, or just life chats, don't forget to hit like and subscribe. See you next week.